And we are back. Welcome back to the Boss Up Like a Queen Summit. I'm your host, Jeannie Marie, and I am extremely honored, okay, to bring you today Dr. Hélène Bertrand, all the way from Vancouver. Yes, she is piping in from Vancouver, and we are thrilled to have her because she is a miracle worker. Okay. This session is called Bossing Up Your Health because this woman has discovered ways to treat people that have never been done before. She's an inventor, a researcher. Well, she's got lots of stories, but today we're going to focus on her mission to heal people because she's an incredible healer with incredible superpowers. And we are so lucky to have you today, Helene. Welcome to the show.
Well, thank you so much, Jeannie Marie. I'm so glad to be able to talk to you and to tell everybody how they can fix their own pain. Because for the last 12 years of my medical practice, all I did was treat people with severe chronic pain. And I did it like doctors would send me their hopeless cases. And I used to try and figure out what's behind this pain, what's going on. And once I had found out what was behind the pain, then the treatment becomes obvious. And so I could fix it. 80% of all those who came to my office with untreatable pain ended up with no pain. And the reason I did it is because I love solving puzzles. It's fun.
Well, but there's so much more to your story than that. I mean, okay, so this woman has had an incredible journey. She's very humble, of course, but we want to know really because so many of the people that are watching this, so many of our audience are people that are trying to boss up to the next level of their life, whatever that is, whether it's getting out of pain or a relationship or a career transition. And the women that have been speaking are all have a certain inspiration, a certain drive, a certain secret something that we are sharing with the world so that people can be inspired like, oh, she did that. This is how she did that. Why? And then it helps people and inspires people to maybe move in a different direction. So I really, and I know we talked about like you sharing your story of how you got to be like the great healer that you are. You've had quite a journey.
I had a really difficult journey. I was, after my first pregnancy, I actually starting at the end of my first pregnancy, when I was an intern in the hospital, by the way, at the end of my first pregnancy, I started having unbearable back pain. Like I could hardly walk. I couldn't roll over in bed. I couldn't get into bed. Going from sitting to standing was a problem. Like after my baby was born, I couldn't even go upstairs carrying my baby. I had to sit on the stairs and push myself up on my feet and on my sits to manage to make it up the stairs. I mean, I was in horrible pain, and I tried everything. Believe me, I tried everything. Um, Chiropractors, massage, acupuncture, exercises, Pilates, you name it, I tried it. And it didn't work. And and people, the doctors, I went to a whole bunch of rehabilitation specialists, they didn't help. And then I went to physiotherapists. They gave me a whole bunch of exercises, which I did religiously, and it didn't work. And so I was, and the pain would get better for a few days, and then it would come back, and it would get better, it would come back. I was trapped with pain. And eventually I was a doctor. I was practicing as a doctor at the time. And at the time I went to this, I was going to a talk on the diabetic foot. And I was with a friend of mine who was a rehabilitation specialist. And I said, oh, God, my sacroiliac joints are killing me, because I knew by then that it was the joints that join my pelvic bones to my sacrum. They're the lowest part of the back. And I said, I couldn't even sit down without hurting. And so he said, he said, come over to my place. I'll do prolotherapy on you. I said, Prolo, what? And so I went to his place, obviously, and he did a bunch of injections of sugar water where the ligaments that hold my SI joints, the ligaments attach on the covering of the bone. And he did that. And then it took about a month. He did it again. And then a month later, he did it again. And then presto, I was pain-free. That was it. Wow. And so, I started sending him a whole bunch of patients, and they all got better. And so I said, wow, this is great. And then 6 months later, he tells me he's retiring. I said, you can't do this to me. What am I going to do with all my patients who are suffering? And he said, oh my God, it's my phone's ringing. Just a second. Hello. All my patients were doing so much better. I was happy to be sending him all these patients for prolotherapy. And then 6 months later, he tells me he's retiring. I said, you can't do this to me. What am I going to do with all these people who are suffering? And he said, I'll teach you. And I said, sure, why not? And so for actually 6 months, he came every Friday and he taught me, you put your needle here, watch out, don't do this part, this is how you make your solutions, and so on and so forth. So after 6 months, and I started taking a whole bunch of continuing education courses on how to do prolotherapy. And pretty soon I was fixing people's joints, I was fixing people's backs, and I loved it. It was fun.
What a rush. Yeah, what a rush. You're totally creating miracles.
Exactly. But then at one of those lectures because I went to a lot of continuing education classes, at one of those lectures, somebody said that they were injecting sugar around nerves that were going to painful areas. And that would immediately shut down the pain signal. And I thought, oh, I've got to try that. At the end of the talk, by the way, I couldn't believe it. At the end of the talk, he said, how many of you here have severe chronic pain? And 7 people put up their hands. And he said, well, why don't you come up here and we'll inject this sugar water around your nerves? And he did that to the 7 people, and presto, the pain was gone. And so I thought, I've got to start doing that to my patients. But I had a lot of diabetic patients, and diabetic people, if you put sugar around their nerves, sugar destroys their nerves. You don't want to do that. And so I thought, what's closest to sugar? And what's natural? And I thought, mannitol. Mannitol is a sugar molecule with one OH, and all the plants and all the mushrooms have it. It's totally natural. And so I started injecting that around nerves. And sure enough, before the needle was even out of the skin, the pain was gone.
Wow.
And so it was fantastic. And I was so thrilled. And so I started doing that to my pain patients. So I had these two techniques to remove pain. And I did that. And then, but a lot, I had to charge for doing those injections, because first of all, it took me about half an hour to an hour, and it was, I had to buy my materials and so on and so forth. So I was charging, and some people couldn't afford that. And I thought, I've got to find another way to fix the back. And so I thought, now, why is that low back pain called non-specific? And I thought, well, there's a big difference between us and animals. The animals, essentially, they put all their weight on their front paws, the weight of their head, the weight of their chest, the weight of their spine, all goes on their forepaws. We're vertical. We don't put all our weight on our forepaws. We have hands instead. And so what do? All that weight, the weight that goes from our head to our shoulders, to our hands, to our chest, to our stomach, to our kidneys, to our liver, to the food we eat, to the fat we've got, all goes on our pelvic bones. And if you want to know where your pelvic bones are, just your sits bone, you're sitting on them. And also, if you put your hands down, you'll feel the two bones there. So you've got this big pelvic bone, and it carries the weight of your whole upper body. And that weight pushes them away from the sacrum at the base of the spine where they attach. And at the same time, those pelvic bones hold your hip joints here. And every time you put your foot on the ground, it jolts your pelvic bones.
That's an incredible analogy. I mean, that's so, good to understand how all that works. It's enlightening,
They are your body's main shock absorbers. So instead of being smooth like every other joint, they're full of bumps and hollows because they're absorbing the shock of every time your foot hits the ground. And so these bones are the most stressed. These joints between the pelvic bones and the sacrum are the most stressed joints in your body. But because they're irregular, they're full of bumps and hollows, they can't be seen. They can't be seen with X-rays, CT scans, MRIs, ultrasound. They cannot be seen. And if they can't be seen, according to the medical profession, they don't exist.
How is that possible?
Well, essentially, back pain that's coming from these joints is called non-specific because they can't reach a diagnosis. So I've developed a way to see where these joints are and in what position they are, and by how much they're displaced, if they're displaced. And if they're displaced, then I've developed a way to fix it. And that's essentially what I'll be letting people have if they want to email me. So that's my
other. She's giving you a sneak preview of her free gift, which all of the speakers have so generously offered. And also we were talking earlier, the doc and I, about congratulations, she just finished her book.
Yes.
Which is amazing, which takes you on the journey. And I think the message that you have about finishing the book is phenomenal. I really would love you to share that.
Okay. Well, what happened is that in April, like I was a member of the Canadian Pain Society, because all the people who deal with pain, the doctors, the surgeons, the chiropractors, the physiotherapists, the massage therapists, all these people are part of the Canadian Pain Society. So because I dealt only with pain, I'm a member of the Canadian Pain Society. And in April, they were presenting a case of low back pain, which to me, because I'd seen thousands of low back pain cases, I knew exactly what was wrong. And I knew it was because she had displaced sacroiliac joints. And so they were talking about the physiotherapy and the massages and the painkillers, and were we going to use narcotics because her pain was so bad, and so on and so forth. And even there was even a surgeon who said, well, maybe we should fuse her spine. And I said, no, no, no. What she has is displaced sacroiliac joints. And immediately they shut me down. I was no longer part of that Zoom meeting, and I was sent a letter.
Terrible, so terrible.
Yeah, and I was sent a letter saying you shouldn't make any mention of this anymore. And so, in about a month and a half ago, I was at another meeting of the Canadian Pain Society, and they were talking about severe chronic pain and how we had to deal with it with narcotics, and how it was a problem, and how physio wasn't helping, and all that stuff. And so in the chat, I put in, I've invented a new way to diagnose and treat low back pain in 2 minutes, which removes 90% of all those who suffer from this pain. And immediately I was shut down from the meeting. And then this time, the president of the Canadian Pain Society emailed me and said I was no longer a member. And the reason that he said I was no longer a member is because I don't know. I mean, what is it that they don't want to remove pain?
Yeah, I mean, how can they be like that? I mean, this woman's got an amazing remedy, and it makes absolutely no sense. So much of the world makes no sense. But
well, the problem is that what I do, anybody can do at home themselves. They can fix their own pain. And I've invented a whole bunch of ways to fix people's pain, like how to make your own orthotics to fix your foot pain and your knee pain and your hip pain. I've made essentially I've invented this QR cream. Like I was examining, I was injecting these people, and the pain was going away like that. And this pharmacist was looking at me, and she said, people don't like injections. Why don't we make it into a cream? I said, sure, let's make it into a cream.
Why not? Yeah, you can do anything. This woman can do anything. Is
So
all this in your book, Doc?
no. We tried 16 different ways, different base creams, until we found one that allowed the mannitol to penetrate and to reach the nerves. And when we found that one, I gave it to 235 of my patients with 289 different pain conditions, like headaches to foot pain, everything. And the average pain relief was 53%. Okay, not 100%, but narcotics is 36%.
Wow. You need that. Yeah.
Aleve and Voltaren is 23%. So 53% is not bad. The average time to relief was 17 minutes, and the average duration was, actually, I couldn't do an average because some people put it on once and the pain was gone. So you can't divide by infinity. So I had to do a median, and the median was 4 hours. So I know that this cream works amazingly well to relieve pain. But of course, it's a cream. And so the nerves that it calms has to be less than maybe half an inch from the surface of the skin. So the nerves of the feet, the nerves of the ankles, the knees, the neck, the fingers, wherever the skin nerves are close to the skin, for wherever the nerves that supply a painful area. And now I want to do it for itch, because I had written a paper on how to use prolotherapy to repair shoulders. And I proved that it was twice as good as physiotherapy. And it repairs the ligaments and the tendons and the joints. Anyway, so I'd done this.
So much good knowledge. So much. You are in endless ways. You're a healer. We are so blessed, so appreciative that you came on and shared this with all of us, because I know there's people that are feeling suffering, to your point. Absolutely. Doc, how have you used women in your community to help you boss up to get to this level of healing?
My business partner, because of course I'm selling QR cream, and you can look at qrcream.com if you want to find out how all these techniques that you can use for different parts of your body. And anyway, my business partner is a woman. Her name is Marilyn Kiriazis. My research partners are women like Ellen Wiebe and Farah Shroff, and I've got all kinds of women helping me.
This just shows when you put women together, okay, this is another example of how powerful we can be together. We rise together.
Absolutely.
So we have to close out. A couple questions left. One, because we asked this of everyone, one piece of advice for our audience to boss up. Dr. Helene's advice to boss up, one thing.
Look at the silver lining in every cloud. There is always a good thing to happen when bad things happen to you. Like I had 37 years of low back pain, and because of that, I've invented all these ways to relieve pain. And there is always a silver lining to the cloud.
That is a tremendous message. And it's true. Wherever your journey is taking you right now, it's for a reason. So as painful as that was, I'm not glad it happened, but I'm glad you're able to create relief for so many people. So thank you. And thank you for being with us. And now, Helene, if you can tell everyone about a little more about the free gift that you're so generously offering.
Well, if you suffer from low back pain and you want to know whether your pain is coming from your spine or it's coming from your SI joints, I'll send you a video on how you can diagnose yourself. And if you get my book, which is about to appear, and you can also pre-order it, if you get my book, it will tell you all the ways that you can fix your low back pain and all the ways that you can prevent it from happening again.
Got to get that book. It's going to ramp up to bestseller in 2 seconds. How should they get in touch with you, Helene? What's the best way to get in touch if they want to get a hold of that video?
qrcream3@gmail.com.
Oh, that's so easy. qrcream3@gmail.com.
Yeah.
Everyone, let's thank the good doctor for being with us today again. And we really appreciate you and all that you're doing for this world. It's amazing. We need more people like you.
It's too bad you didn't ask me about the new research project I've got, because I had this woman who had an unbearable itch in her scalp, and she came to get her shoulders fixed, and she was itching so badly that she didn't have any more skin, any more hair on her.
Awful.
She just had psoriasis on her scalp, and I said, well, if you keep scratching, your shoulders are gonna get bad again. And she said, I can't stop, doctor. I've had 15 years of this. And I said, well, what have you tried? She says, I've tried everything. And I said, well, wait a minute. Why don't you try this cream that I'm trying? So I put this mannitol cream on her scalp, and she said it's not going to work. 3 minutes later, her itch was gone. And when she came back a month later, she had this much hair all over her head and no psoriasis. So I want to try it on 10 people who have unbearable itch from psoriasis. And if you do, I want to hear from you because I've got a 3-month supply of this cream and I'd like to see if it's going to work for you.
QRcream3 at gmail.com.
QRcream3 at gmail.com, and glad to have them try
What a
it.
nice offer. What an amazing offer. Take advantage of this, guys. Boss up your health. All right. We'll see you guys tomorrow. All the best. Thanks, Doc.